Hello, my name is Nolan Gugazal. Today we're going to be going over the small volume nebulizer competency. So the first thing we want to do is review the patient's chart for the treatment details. So we want to review the medication, the dose of medication, the frequency, and then the route as well. So this one's going to be small volume nebulizer, a unit dose 2.5 milligrams of albuterol through the small volume nebulizer just once right now as needed. So for frequency. After that, we're going to go ahead and gather our supplies. So we want our pulse oximeter, we want our stethoscope, our PPE, our unit dose albuterol, napkin to cough into later, our disinfecting wipes for our stethoscope, our peak flow meter, as well as the peak flow chart to determine the predicted flow rate, our oxygen wall mount, our recording utensils, as well as our flow sheet to record on with nothing on it. We have our calculator to do these calculations, as well as our hand sanitizer. So after this, we're going to go ahead and sanitize our hands for 15 seconds or more as we enter the patient's room. Hello, my name is Nolan Gugazal. I'm a respiratory therapist with the Hartnell College Respiratory Care Program. What is your name?
Neftali Lazaro.
Okay, and your date of birth?
10/6/92.
May I confirm that with your wristband? Perfect. Okay, so we're going to go ahead and confirm the patient's identifiers with two identifiers, first and last name, as well as date of birth. So we confirm that. After, we're going to go ahead and explain the procedure, as well as gain consent. So since you came in today with a asthma exacerbation, we're going to go ahead and give you a unit dose of albuterol. Okay, it's going to help open up your lungs a little bit, help you breathe a little bit easier since you're having a little trouble breathing right now. Have you ever had albuterol before?
No.
Okay. One of the side effects of albuterol, or a couple of them, you can have shakiness, a little bit of dizziness, dry mouth, or increased heart rate.
Okay.
If at any time during our treatment you go ahead and notice that, let me know immediately and we'll go ahead and stop, okay?
Okay.
So I'm disinfecting my stethoscope. Go ahead and dispose of that. And I'm going to apply my PPE. Okay, do you have any questions about this?
No.
Okay, if you had any family members in the room right now, we can go ahead and ask if they have any questions and confirm their understanding of the treatment as well. So we explain the procedure and we gain consent. We're going to go ahead and go into our assessment now. So we're going to go ahead and use a pulse oximeter. Okay, I'm going to go ahead and put this pulse oximeter over your finger, all right? It's going to measure the amount of oxygen you have in your blood as well as your pulse. Go ahead and leave that there. While that's going, I'm going to go ahead and take your pulse and your just your pulse right now. Put this on your chest. Thank you. So I'd be taking the pulse for 30 seconds and then the respirations for 30 seconds. I'm going to let the patient know that I'm doing the pulse for a minute so that they don't alter their respirations consciously. Alrighty, so we're going to have a pulse of 30 and a respiration rate of 10. Thank you. I'm going to leave that on for just a second. So we're going to multiply that by 2. So our heart rate is 60 beats per minute and a 20 respirations per minute. I'm going to go ahead and check. She is sitting at 98% right now. 98%. I'm going to record all our data. So I'm going to go ahead and assess for skin signs. Good color right now. Warm to touch. No signs of cyanosis. Are you having any trouble breathing right now?
No.
No? Okay.
Oh, actually, yes, I am.
You are, okay.
Yeah.
From 0 to 10, 0 being nothing, 5 being in the middle, and 10 being extreme, how would you rate that right now?
6.
Okay, so a decent amount of trouble breathing. Write that down. Okay. So next we're going to go ahead and take some heart sounds as well as lung sounds, okay? I'm going to place the bell of my stethoscope to your skin, warm it up a little bit so it's not as cold. We do this so we can hear a little bit better as opposed to over your gown.
Okay.
I'm going to start by taking those heart sounds. Okay. Thank you very much. So noting S1 and S2, good rate, rhythm, and quality at about 60 beats per minute, strong and regular. So we're going to go ahead and do these lung sounds now. We're going to do 8 on the back, 8 on the front, 2 on each side, and 1 over your throat, okay?
Okay.
Go ahead, when I place the bell to your skin, take a big breath through your mouth. If you feel lightheaded at any time, let me know. We can go ahead and stop.
Okay.
Okay, big breath in. Good. These are going to be on your side, okay?
Okay.
So mid-axillary line. Thank you. Okay, mid-axillary, a little closer to your armpit. Okay, same on this side. Perfect, thank you very much. So we're going to do the same on your front, okay?
Okay.
Go underneath your gown. Go ahead. Okay, thank you. We're going to go up the top for this one. Okay, thank you. And this last one's going to be right over your throat, okay?
Okay.
Okay, thank you very much. So we heard wheezing over on the right and left lower lobes, anterior and posteriorly, so we're going to go ahead and mark that down. Most likely due to the asthma exacerbation right now. Other than that, we had good clear breath sounds, just the wheezing in the lower lobes. So after that, we're going to go ahead and we're going to do our peak flow meter to assess the patient's ability to exhale air in a short amount of time. So this is our peak flow meter. What we're going to do is we're going to breathe into it as fast as possible. So we want a nice hard exhale. And we want to move this red line when we blow into our targeted value, okay? Based on the patient's chart earlier, the age and height, we determined that she should be blowing around 418, okay? So that's where we're gonna set our green marker at. Okay, thank you very much. So at this point, we're gonna place our patient into Fowler's position. Upright works. We want the patient to be upright, head up, shoulders back with good posture. This is going to do for Fowler's position since the patient's able to hold themselves upright. Go ahead and hold that, feet planted firmly on the ground. And we're going to take the best of 3, okay?
Okay.
Okay, good job. First one is 190. We're going to reset that. Okay, good job. Noting the patient's effort, so good effort right now, having a little bit of difficulty due to the asthma exacerbation. So we're at 170. Reset that. Okay. And 170. Okay. Thank you very much. So we have 190, 170, 170. We want no two results to vary more than 150 mLs to ensure good accuracy. We had good patient cooperation and effort. So we're going to go ahead and do a little bit of math here. We're going to take the highest, 190, over the 418, and then multiply by 100. So we're at 45% of our predicted. So we'll go ahead and after the treatment reassess this to hopefully improve, get closer to our predicted. Okay, so we're gonna go ahead and do our albuterol treatment now, okay? We're gonna first set up your the device. So we are going to be using this portable oxygen. We're going to open it up. And since our patient is alert and oriented and they're able to follow commands today, we're going to be able to use a mouthpiece. As the treatment is moving, we can go ahead and assess how well they're using the mouthpiece. If they are unable to, we can use a mask for better effectiveness. So we're going to plug our 50 psi in. We're going to plug into the 50 psi wall outlet. Make sure that's nice and flush. We are going to plug in one end of our tubing to the wall. It's down here right now. Okay. Attach our T-tube. Okay, so this is our unit dose of albuterol. We're going to be putting it in the nebulizer. So our unit dose of albuterol is in there. We can go ahead and dispose of this in the proper disposal. Okay, so now I'm going to go ahead and write the patient's name on the nebulizer, or the data setup, as well as the date of expiration too. So today's date is November 6th. I'm going to do it on tape so we can reuse the nebulizer later. So we want the date of setup as well as the date of expiration. So that should be 1 week from now. If it's contaminated, we can go ahead and do that earlier. Right on this. Today's date, 11/6, and the date of expiration would be 11/13, recommended expiration. Okay, so I'm going to go ahead and turn on the wall outlet to 6 to 8 liters per minute. We're going to do 8 liters per minute right now because she's able to tolerate that. So when we do this, we're going to place your mouth over the mouthpiece, okay? Tongue underneath and your teeth gently sitting on the mouthpiece. And then purse your lips around that. We're going to take a nice regular breath. You can go ahead and hold that. I'm going to turn this on. 6 liters a minute. Okay. So you're going to place your teeth over that, your tongue underneath, and seal your lips around it. We're checking for the presence of aerosol gas so that to determine it's working. Coach the patient through nice even breaths. Periodically, we're going to want to do a nice deep breath for total lung capacity. Inhalation, max inhalation, and hold for 3 to 5 seconds to deposit into the lower airways. We're monitoring for hyperventilation or hypoventilation, making sure the patient's steady. If at all you feel any of those adverse reactions or those symptoms you're talking about, go ahead and let me know, okay? And we'll discontinue immediately. So after this treatment's going to take a little while, but as it starts to run out, it'll begin to sputter. We're going to want to take the SVN from the patient and flick it to get any of those condensation particles to fall back to the bottom to be re-nebulized. So we're going to flick it, get them to drop back down, the patient can resume the treatment. So we're going to be doing this for a little while. After we know we're done when the medication is no longer aerosolizing, we flicked it and it's not continuing anymore. So after that, we're going to go ahead and take this. Good treatment today. How do you feel?
I feel good.
Okay, we're going to go ahead and turn this off. Okay. So we're going to go ahead and clean this for the patient. In just a second, we're going to go ahead and reassess first. Okay, so there's the patient's back. We'll set that on top, and we can clean in just a second. So we're going to go ahead and reassess some of your vitals that we did before, okay?
Okay.
I'm going to have you put your finger into here. Thank you. Okay, so we're gonna get that measurement. I'm gonna go ahead and take your pulse again. So same thing, 30 seconds of respirations, 30 seconds of pulse. Okay. We got a pulse of 30 again, so we'll multiply it by 2, it's gonna be 60 beats per minute. Our respirations were lowered to 7, so it's gonna be 14 a minute. Okay, and her saturation is still at 98%. Okay, may I have you cough for me into this? Okay, good cough, noting the effort of cough and any sputum production. So we want to do the color, odor, consistency, and amount. So no sputum production and a good cough, little effort to be able to generate that. So I'm gonna go ahead and take this off your finger. We're gonna note the skin signs again. So the good color, no signs of cyanosis. Good temperature to the touch. Are you having any trouble breathing right now?
Not really.
Not really? Okay, you were at a 6 earlier, so did that get better?
Yeah, like a 1.
Oh, 1 now, okay. So good improvement there. So we're gonna do 1, and dyspnea. Okay, so we're gonna go ahead and we're gonna reassess your heart sound as well as your lung sounds, okay?
Okay.
We're gonna start with those heart sounds. Again, bellow of the stethoscope to skin for a better sound. Thank you. And noting S1, S2, good rate, rhythm, and quality. Also, we want to note rate, rhythm, and quality for the respirations as well. Any other signs of trouble breathing, such as nasal flaring or any tripoding, any other accessory muscle use. None noted right now. So I'm going to go ahead and start those lung sounds on your back, okay?
Okay.
Big deep breath. Thank you. Good job. So we're going to do the 2 on the side right now. Mid-axillary line. Good job. Okay, it's going to be mid-axillary line under your armpit. Thank you. Good job. Okay, we're going to do the same on the front again. Okay, thank you very much. So no wheezing noted this time in the lower left or right lobes, no other adventitious sounds in any of the lobes or segments, so clear lung sounds overall. We're going to go ahead and take note of this. Clear lung sounds, the right and left lower lobes as well as all other lobes and segments. Okay, so after this we're going to go ahead and do the peak flow one more time, okay? Same thing, we're going to do 3 tests, and we're going to take the best and we're going to compare it, okay? So hopefully you improve, you're able to blow a little bit more. So again, our target's going to be 418, okay? So feet on the ground, shoulders back still. Good job. So we're at 400. Okay, I'll go ahead and record that. Job at 360. And at 410. Okay, good job. Okay. So the patient, it did vary just a little bit. So can we go ahead and have you blow one more time just to get 3 results that are within 150 ml? Perfect, good job. 400 again. Okay, so we have 410, 400, and 400. Our peak is going to be 410. So we're going to do 410 divided by the 418 times 100. A little bit of math. So we're at 90%, 98% of the predicted, so that's a very good job. And then we're going to compare the pre and post results. Okay, so it's going to be 98 minus 45 over 45. 98. Okay. And then we're going to multiply that by 100, so it's going to be an 80% increase. So good job. The albuterol treatment was effective, over 20% increase. We're going to go ahead and note this. Okay. Good job. And you're still feeling good? None of those side effects that we were talking about?
No.
Okay. So after this, we're going to go ahead and follow up with the patient. We're going to go ahead and rinse their medication for them, their SVN. We're going to note on the patient's bag, so we have something to place it in when we're done, the patient's name, the date opened, that is also, and set up, that is also on our SVN. We're going to put 11/6, and then the date recommended to be changed, which will be November 13th, unless it's visibly dirty before that. Okay, so we're going to go ahead and take this apart. We are going to clean it with sterile water. So we have our sterile water right here. Go ahead and rinse it out. We can use our medical air oxygen to help dry it. So we really just want to flush it with water. Go ahead and dry all these parts with the oxygen. If it still needs further drying, we can go ahead and leave it to air dry. It is dry right now, so we're going to go ahead and place it back in the patient's bag for their next treatment. Take it apart completely. Labeled. You can hang this on the patient's bed or in their room for the future respiratory therapist. So now that everything's put away and clean and dry, we can go ahead and thank the patient. We are going to chart any of our data and talk to the physician, nurse, or appropriate care provider to update the care plan and put in any pertinent information. So we're going to go ahead and chart that. Is there anything else I can help you with today?
No.
Okay. Thank you very much for your cooperation today. I'm going to desanitize my stethoscope. Disposing the glove. I'm going to put the room back in the order that I found it. Wash my hands. I'm going to exit the patient's room.